Hi, welcome to Live United. My name is Karen Knapp, President, CEO, United Way of St. Lucie County. United Way's mission is to improve lives by mobilizing the caring power of our community that's right here in St. Lucie County. United Way identifies issues along with our community partners, and then we work to address those issues. One of the ways we do that is by funding programs. We also run a few programs ourselves, and one of them is Tools for Schools. And today with us is Jessica Parrish. Jessica, you've just taken the bull by the horns, and now you're off, and you're made some changes to what we normally have done in the past, and it looks like we're moving forward in a very, very positive direction. Let's talk a little bit about Tools for Schools.
Okay. As you mentioned earlier, United Way does address unmet needs in the community, and back in 1997, an unmet need came to the focus of United Way, that students were going into school unprepared. So United Way started a school supplies program where they collected donations from the community, packed it up into Publix brown bags at the time, and distributed it to 625 students in that first year, back in 97. Today, we just finished the calculations for the 17-18 school year, and we served over 11,000 students in the community, providing them with just over $786,000 worth of school supplies. Bulk of those came from our community partners such as Publix and Walmart, and then a lot of it came from school supply drives in the community from different organizations also. So each year we partner with Publix. They run it's called a Tools for Back to Schools drive. They collect cash donations at the register, so when you're grocery shopping, you go to check out. I noticed that yesterday there was a little sign on the register that said, my goal is $80 for the Tools for Back to School drive, and they'll ask you if you want to contribute $1 or $5. Those donations in turn purchase school supplies. And we are the lucky local organization for St. Lucie County that receives those bulk supplies from Publix.
I know I was shopping at Publix the other day, and they said, well, would you like to give to Tools for Schools? And I said, oh yeah, that's United Way.
Yep.
And so I gave her some money, and all of a sudden she raises this clapper and she starts shaking it, and then all the ladies at the registers and gentlemen started, using their clappers, and it was very amusing. I appreciated that.
That's funny. When I checked out, I contributed money, and they said, do you want me to do like a whole big dance for you? I said, no, it's okay. We'll be all right. I made the donation. I'm good. You don't have to dance.
So evidently they don't all have clappers, right?
No, this one didn't have clappers. They were jumping up and down, screaming and shouting. I said, no, it's okay. You don't have to do that. But last year, from those donations that are provided at the registers, we received 35 pallets worth of school supplies that helped us bump up the number of served. So for the 16-17 school year, we served just over 6,600. And last year, we were able to bump it up to over 11,000. Tremendous.
Right, and you made some changes in the program. We're moving forward and really taking care of the needs. Let's talk about that.
Yep, so during the first year of me at United Way, we did a survey of all the teachers and the guidance counselors to see how the program was operating for the last 20 years. And come to find out, a lot of the teachers weren't receiving the supplies for the classroom. Some of the schools, the students had to go to guidance to ask for the supplies. So it wasn't really hitting the classrooms as we had initially thought. And also doing some research, I found that teachers on average spend about $1,000 of their own money on school supplies for students in the classroom. That's everyday student just walking into the classroom and Mrs. Smith providing them with school supplies because their family can't afford to do so. So we were looking at changing the model a bit to have it more of a teacher shopping center where teachers can come and pick up the supplies at no cost for their classrooms directly. So they can come pick up backpacks, composition books, copy paper, whatever they need to make their classroom successful. And those supplies can go straight down to the student right there. As a teacher notices that the kid doesn't have a pencil for a test, she's able to hand them a pencil with no issues right there. So that's the model we're looking at. We did pilot that type of model beginning in January. We did an online store. We had 2 schools that were able to shop online. The teachers selected their items and the packages were delivered to the schools. This year we're looking at doing it a little differently so we can expand to more schools. We're looking at locating a physical space where teachers can come in and shop, just like a retail location. They can pick the items off the shelf and things like that. Some of the items will have quantity limits because we don't want all of our pencils to disappear with 1 or 2 teachers. We'd like to spread it out. But most of the supplies will be available right there for them at no cost.
And you are looking for sponsors?
We are looking for sponsors to assist with the store. We're also looking for anyone who wants to run a supply drive to help us keep our shelves stocked with the supplies year-round. This is more of a year-round endeavor, where previously it was just a delivery of supplies come August. So now teachers have a constant access to supplies on a continual basis. We're also looking to identify physical space. We have some prospects in place, but we really need about 2,000 square feet for this physical store to help facilitate the shopping of the teachers.
Under AC, right? Under
AC preferably, yes, especially with Florida heat, yes.
And the United Way kickoff, that's coming up now too. We typically had a breakfast, but now we have switched that up a little bit, and we're going to have a day of caring. Let's tell our audience a little bit about how they can participate.
So our day of caring is going to be held on September 29th this year, which is a Saturday. We'll kick it off with a breakfast at the Riverwalk Center starting at about 8 o'clock, and then we're recruiting projects. So we are bringing in projects from different organizations countywide, and we will match volunteers at the projects. So 6 or 7 projects can be done at one time on that Saturday with the volunteers. So we're recruiting projects from organizations in the county. We're recruiting volunteers that want to go out and help assist those projects. And then if any organization wants to put together a team of volunteers from their agency, we're recruiting for that as well.
And who would they contact?
They can contact either myself or Roxanne Wells at the office. They could call the phone number of 464-5300 and ask for either one of us, and we'll be more than happy to help them.
And what about, it's on our website?
It is on our website, yes. There is a Day of Caring information section on our website, so if they want to further up on information. All of the forms will be up there as well. We're reducing and recruiting on a different cycle, so different forms will be up there at a different time. We're just getting ready to start recruiting for volunteers to match them to the project, so those will be available shortly.
That's great. That's wonderful. Yeah. Well, I want to thank you for joining us. We've got a couple other guests coming on.
Thank you.
Yes, and good luck.
It's me, Artie. Come see what I collected from the Creative Galaxy in my idea box.
Transform your world.
Will you help me make art?
Each one of our journeys keeps us young.
Before you throw it away,
Hey, I have an idea.
think outside the box.
We'll never get older. Each one
Go be amazing!
Give your cardboard box another life. Recycle.
Hi, welcome back to Live United. Our guests now are from Tykes and Teens and Early Learning Coalition. Welcome.
Thank you.
Thank you.
Tony and Jeff, wonderful guests. Early on, the United Way Vision Councils identified children's mental health as an issue, and with that, and through our grant process, we were able to fund not only early learning once again with their programs, but also there's a new program, addressing children's mental health, and that's so important. Let's tell our audience a little bit about Tykes and Teens, what your mission is and what you do in our community.
Well, our mission is to provide affordable mental health services to children and their families. We've been providing services for about 22 years, and about 3 years ago we were exclusively in Martin County, but about 3 years ago we decided to expand into the other counties, specifically because of early childhood mental health. That was our driving force, and there's a lot of brain science associated with emotional regulation issues and how that is developed in early childhood. And since mental health is our mission, it makes sense to be able to support organizations and families to make sure that their children are best prepared when they enter into school. And so that was kind of how our collaboration with early learning began to develop.
And United Way is excited about funding this new program and also about the collaboration you have with early learning. Hi, Tony. How are you?
Good.
I know we recently had you on. Let's talk about your mission a little bit before we get into the program.
Sure. So the Early Learning Coalition, we offer what I would consider 3 main programs. First is VPK, it's free for all 4-year-olds. Next is Child Care Resource and Referral, which any parent or caregiver can reach out to us, and we can customize a list of child care centers, give them information on what to look for when they're trying to choose a child care center. And then we also have our main and original program is our school readiness funded program. And that is where we subsidize childcare for those families that are income eligible. And within that, they have to be at 150% or less of the federal poverty guidelines and working and or going to school. But we also have a component, our child care executive partnership, which United Way funded for us, where that is a dollar for dollar match. And we can serve families that are over the 150% and up to 200% of the federal poverty guidelines.
Well, it's so heartwarming, and we are very pleased to support your program. But when you know that the daycare centers that you oversee or that you partner with and work with and you support are really quality programs, and they meet specific standards, which is really vital to the health and well-being of our children here in St. Lucie County.
Yes, definitely.
So, children's mental health. You know, we're talking about the very young, of course, when you partner with early learning.
Yes.
Let's talk about the issue itself and how you're addressing it.
Well, children basically learn through relationships. And if a relationship is impacted because of some mental health issue, stressful situation like domestic violence or substance abuse issues, it will impair the child's development. And of course, the primary goal of early learning in schools in general is to teach kids basic academic skills. But what we have learned is that if kids cannot be present to be able to learn, they can't learn. And so that's where our collaboration with education systems have really increased, because we want kids to be present in the classroom so that they have the capacity to be able to learn the materials that teachers are trying to teach them. And there's a kind of a milestone study that was done called Adverse Childhood Experiences that came out in the late 90s that really showed how these adverse experiences in childhood impacts health and well-being is where it started, but we've now since learned that it significantly and permanently impacts the brain development and your ability to be able to be present, to manage your emotions, and be successful as an adult. And there are some other factors that are kind of related to that, but that's really my primary goal of focusing on early childhood mental health. And actually, we work with children at birth, from birth on up. So, like for instance, if a child is born addicted, that's going to impact their ability to be able to connect with their caregiver. So whether that's a child who's in foster care because they were removed, or whether they are with their primary caregiver, that addiction process can significantly impact their relationship. And since relationships is how we learn and grow, our ability to be able to work with that dyad can help that child have a more positive outcome.
Okay, infant mental health consultation. Let's talk a little bit about that.
So the model that we actually use in child care centers, so there are multiple relationships, right, in the child care center or in the child's life. So the primary relationship is with the parent, and we actually have an intervention that we do with families. The intervention that we actually do at a child care center is called infant mental health consultation. And basically what we do is we, as our staff members are housed actually at a child care center, they begin to develop relationships, not just with the teachers, but with the administrators as well, because we also look at policies and how those policies impact the relationships that the children have. It may surprise you to know that children in child care centers are 3 times more likely to be expelled from school than they are in the K-12 system, which is pretty remarkable.
And why is that?
Well, because they're privately funded, and they have the right to decide who's going to be in their facility. And if a child's biting or being disruptive, probably the easiest way to manage is to ask them to leave. Except what happens is that child then is impacted, that relationship impacts them and will impact them in the next center that they go to. And so instead of providing resources and wrapping ourselves around those kids so that they can be successful in that center, the tendency has been is, well, we'll just move them to another center, give them a new start. But that actually doesn't work. So actually this model is to do that we actually wrap around the child as well as the center staff themselves. I'm sure you are aware that staff are woefully paid, and they are not provided a tremendous amount of education to be able to work with very difficult children, and that is our expertise. So by being able to go into the center site, having the relationship with the staff so that they recognize that we are there to support children, not to judge them. We get frustrated, we say things, we do things that we know that we shouldn't, but that's where we're at that moment in time. If a kid is biting me or throwing a chair at me, being composed may not necessarily be my best attribute. And so we help assist them on how do they regulate themselves so that they can be present when a child is engaging that, help them understand the meaning of where that child's behavior is coming from. We have a tendency to automatically assume, okay, this is a bad kid. Or that they're mentally ill, which is another, that there's something biologically wrong with them. And the majority of children are responding and communicate through their behavior, especially very young children, because they don't have the language capacity to be able to articulate what's going on. So what we do is we help interpret for those kids to their caregivers so that their needs actually get met. And one of my other major initiatives in regards to this program is that we get lots of referrals from Department of Children and Families, so those are families that we know have had adverse experiences in their home, and we're going to navigate that, but they're court ordered, so they have to participate. And then there are those families who recognize, hey, things are not going, and they're going to seek out help. But the families that I get most concerned about are those that are in the middle, that they're on the periphery of kind of adverse things that are going on in the home, but they don't necessarily recognize or don't want anyone to know what's going on in the home, so they're not going to seek out help. And since children learn through relationships, well, the next best thing, it's not the best thing, but the next best thing is that relationship with their child care worker. And so if I can make sure that that's the best that it possibly can be, then our outcomes can really have that. So that's those kids that are on the borderline. If I can tip them over into that resiliency component so that they can be successful, so that they can learn their trajectory for the rest of their life can be dramatic. And again, that's why I have such an investment in that early childhood. The child's brain is 80% developed by the time they are 5 years old, 60 years of age. So when we talk about brain structure as it relates to emotional regulation, and I'm not going to get into all the details of that, but there is a huge component about how the brain develops and how it regulates its emotions. So if I've grown up in an environment where it's been highly toxic, so my mom is off the roof, or there's a lot of domestic violence going on, or I've moved from place to place and I don't know where the next place I'm going to get food, I'm in fight-flight mode all the time. And you want me to learn? You want me to know my alphabets and how to recognize the shape or colors? I'm more worried about if I'm going to be safe or if I'm going to get food. But if I can help the child be present through that relationship with that caregiver, meaning the teacher in the classroom, it can actually quiet the brain down enough so that the architecture in the brain can begin to develop. And when we recognize that impact, that's 80% of the development of that child, that will affect them for the rest of their life. We can do that. We can do that in those centers. And that's why supporting and educating the teachers about their actions and reactions, and we call it, they can be the buffer. Because what we do know, research is very clear that it only takes one person to change the trajectory of a child. And most people, it actually is their teacher. So why can't it be their pre-K teacher as well? And so that's
what do they do? They evaluate, they do an evaluation, and then after the year is up, then they see how the child's progressed? Or
well, all ELCs actually do developmental assessments on a regular basis. So we have that assessment, but there's actually another assessment that actually evaluates their social emotional well-being as well.
Right.
And so those are the things that we look at when we're going into the center. So of course we have the kids out there that are obvious because they are at risk for being suspended. But we also look at the kids who have those social emotional things that are not on their normal development, and we reach out to those teachers, children, and their families. Clearly we would much prefer to work with families, and we do have some success, but some families are hesitant. And where we have found our most success, and this really is what you guys have allowed us to do, because some of our services are billable, but a lot of our services in the schools are not. And so your support, what United Way has been able to do for us, is to be able to develop those relationships there within the school. And a lot of the families have a relationship with the school, and therefore if the teacher is saying, hey, these people are okay because I've seen them, they've been here for a while, it's okay to let them into your house. They're not going to do anything. They're not going to take your child away, which is one of the big fears. And so that gives us that invitation to be able to do the family work, which is really where the primary goal is. They are the center themselves, or the entry point to be able to do that, because they recognize that we are safe enough to be able to do that. And I'll give you an example. We've had situations where a child was killed at a child care center. And,
Not yours.
Not at a center, but
No,
the
right.
child
He was
attended
Right.
the center.
Thank you for correcting me. It was a car accident.
Yeah.
It happened on Christmas Eve. And they actually called our staff on Christmas Eve, and they went in the next day that the facility was open. And because not only were the kids going to be affected by this, but the teachers, of course, dramatically were going to be impacted. And that really spoke to the relationship that we had, that they recognized that we would be that support for them to be able to navigate this very difficult situation. And this was a center that also had after-school programming. So they had kids, older kids there. Well, of course, the way older kids process information is very differently than the way the younger kids. So we were able to do some support group for the elementary school kids that were there as well. And that was all because we had a relationship. So some of the traditional methods that mental health providers do is we take the kid, we go into a special room, we do our little special services, and then we bring them back to the environment. This intervention is very different than that. We're in the classroom. We're actually watching what's going on between the teacher and the child. We support the teacher about understanding what do you think that's going on, understand what's the communication here. They are trying to say something to us. We don't necessarily know what that is. And to be able to figure out all of that. It's about the relationships.
Right. So Tony, how do you think this is going to impact the centers and the families?
In a very positive way. We've seen that already. So several years ago, we were seeing an uptick in providers sharing with us that they're seeing more bad behavior within the population, that they're serving, and we were even hearing that from the school board that kindergartners were coming in with a lot of behavior issues. So one thing that we put in place was that, as Jeff mentioned earlier about children being expelled from child care centers, every time a parent that was in our services would come in to transfer to another center, we would just normally let that happen prior to this, but we really started to take a focus on it and get feedback from the director of the center they were leaving, talk to the parents, because then that child, was skipping around, and sometimes a child could be in 3, 4, or 5 different child care centers within a year. So we really started to hone in on that, and then along with bringing Tykes and Teens into the fold and them actively participating and being involved with the centers that they are, has allowed all of that interaction and the support that the teachers and the director need so that they can help those children. Because ultimately, those directors don't want to expel the child, but if they feel like there's no hope or they've done all that they can, then it's like a last resort. So the great thing is, too, that even though Tykes and Teens is only at 5 centers, I believe, we actually offer the services throughout our entire county. So we've had other centers reach out to us to say they're having an issue or a concern, and then all we have to do is get in touch with Tykes and Teens, and they'll send one of their professionals that are working at those 5 centers over to the other center and help them. So it really is a true community, and even though we've got this pilot that we've been working and focusing, doing a deeper dive in a few centers, it's really ultimately helping the entire county as well.
Is there a cost for families?
So we are a Medicaid provider, so as I had mentioned, that some of the services that we do are billable. And so we will bill it, but for families that have like an insurance or maybe not having any insurance at all, we do have a sliding scale so that we do offer that to families as well if they're getting the family-based component, which is what we call the child-parent psychotherapy. If they're just getting the infant mental health consultation, no, there is no fee associated with that. So
Yeah, I was going to ask you about that, the child-parent psychotherapy. Can we tell the audience a little bit about what goes on then?
Sure. So that is a deeper level intervention, and it's specifically done with the child and their primary caregiver. And it basically is a trauma-based intervention in which we recognize how trauma interferes in our relationships with others. So our primary goal is those children who have been traumatized. So if they've experienced some kind of traumatic things, including medical trauma, can have an impact. But if a parent has experienced a trauma and how that interferes in their relationship with their child as well. one of the characteristics associated with trauma is avoidance. We don't want to talk about the bad things that have happened. So if daddy has died, and sometimes parents won't want to talk about that. So if the kid brings it up, we change the subject, we'll go on to something else. We assist families on recognizing that whether we talk about it or not, it's going to impact. And so how do we do it in a meaningful way so that we can recover from it? And it is, we do a deep level assessment, so there are many assessment tools that we do to be able to get to some of the traumatic information. So what I would perceive as traumatic may be different than what you perceive as traumatic, and so we actually just do an inventory, is what we call it, and assess the situations that have gone on, because you may not determine that if you grew up in a family where, well, I won't go into too many details, but where they may not recognize it as a trauma, but it impacts their relationship. This treatment
Yeah, they might
intervention,
recognize it as day-to-day life.
it's just day-to-day life,
Yeah.
yes. But it's impacting the health and well-being of the child. And because they don't read the cues of their children very well, because of this trauma history, the children are often miscued, and then the behaviors escalate. And so we help them understand, hey, this is what your child's trying to say to you. If you knew that that's what they were trying to say, how would you respond?
So a child can recover.
Well, that's the amazing thing about this intervention is that there are brain studies that have been done, functional PET scans that have been done, where there's significant trauma, where the brain has been impacted, and when you begin to do this intervention, literally the brain does recover. The activity, because the primary activity is in that fight-flight center, our problem-solving center is in the front part of our brain, so when you do those PET scans, all that activity is in the back part. When you begin to do this intervention, children begin to feel safe. The activity then begins over all of the development. So when they learn, they have the capacity to be able to learn and maintain that information, which
So
is
if
what the
a
goal
parent
is.
wants to participate, who do they contact?
Well, they can either contact the center that they're at, as Tony had mentioned, even if they're at other centers throughout the county, they can access our services, or they can call our office, which is 772-220-3439.
I want to thank you both for being here with us. I know our time was short, but you gave us a lot of information, and I'm sure that many people learned a lot more than they knew before, so I'm sure it will help many people. And we want to thank you for joining us, and hope we'll see you next time.